Today we are talking about femoroacetabular impingement, known as FAI, a hip problem due to an extra bit of bone. But what are the best rehab exercises to do if you have this? That's exactly what we are going through in this video. Hi, my name's Rob from AMR Physio, and we'll talk a little bit about what it is, exercises that can help, and other options if needing further intervention. The hip is a ball and socket joint, and FAI is due to extra bone growth, which is normally felt with pain in the groin area. This extra bone can be in the form of a pincer, where it's more around the socket area, a cam, where it's more around the ball area, or a combined, where it's around both. It will mean certain positions are more painful or restricted, and it could be something you've had for years and know nothing about and get no pain from it. But it can sometimes get gradually worse, or you could be finding things really painful and it stops you from doing a lot of activity. It can be more common in athletic populations, but this is likely that it's more noticed in this population as doing more movements of the hip itself. Exercise itself, though, wouldn't cause this. One thing that is important with this is to keep the muscles around the joint strong to support it and keep the hip as mobile as possible, but doing exercises that aren't going to aggravate the symptoms at the same time. So this may look like just changing the range you go into or picking a different exercise to hit the muscle without that aggravation. It's always best to have a non-invasive approach first for this to see if it can be improved, with exercises and also modifying activity in your day-to-day. You can do all the exercise in the world, but if you keep aggravating doing other stuff, you'll just go around in circles. So what exercises are good for this? First off, number one is step downs. These are great for building strength around the hip and leg, but also for stability. The other benefit is that you don't need a lot of hip flexion to get good benefit from this, and hip flexion can be irritating for some if going too deep into it. If you're finding that's the case with this exercise, then just start on a lower level step. Number two is a side plank, and this is great for the hip abductors and shouldn't irritate as the hips are staying still. To make this easier, go to a knee, and to make it harder, then also lift the top leg up and hold it. Number three is a banded split squat. Now, this one won't be for everyone, as sometimes going into that deep flexion, as we mentioned, can irritate, but you can do the split squat while having a band on the inner thigh to help distract the hip slightly, which can, for many, feel like they're getting a better, more comfortable range. Now, the band is not going to be strong enough to fully distract the hip with everything that's keeping it in place. However, anecdotally, a lot of people say it makes it feel a lot nicer. So give it a go and see if it works for you. Number four is a hip flexor stretch, so working on keeping the hips mobile here. You want to keep your foot behind you, either standing or kneeling. This is all about tucking your pelvis in to get more of a posterior pelvic tilt to get a better stretch on these hip flexors. Number five is hip flexor strengthening. So laying on your back, have your foot attached to a cable machine and pull your knee towards your chest, but go to a comfortable range of hip flexion. Hip flexor strength is something that gets really neglected and not recommended enough, especially if you are suffering with hip issues. It's something you should definitely give a go. Number six is bridging. So laying on your back, squeeze your buttocks and lift your bum in the air so that your knees and hips create a straight line. Adjust the range accordingly for this, but it shouldn't be aggravating. And to make this harder, you can do it on a single leg. Number seven is a piriformis stretch. This is to help open the hip up more into an external rotation, which can feel more relieving depending on what type of impingement and whereabouts it is. If it is aggravating though, then I'll just take this one out. This is basically the opposite of the more provoking movement that we use for a test, which is called a fader test. So it's basically flexion, adduction, and internal rotation, and that tends to be much worse with FAI. But the external rotation tends to be nicer and is a good stretch to help keep the hips mobile. Don't do the leaning forward with this stretch though, as that deeper flexion can be what might irritate. Keep your body more upright or do it on your back without bringing the knee too far towards your chest. If you find that you aren't getting anywhere with doing different exercises and modifications of your daily activities, and it just keeps gradually worsening, or it's really affecting your quality of life and stopping you doing many of the things you enjoy, or it's impacting on things like work, then it might be time to consider more of a surgical approach. And this is where they'll address that extra bone growth. You'll still have to do a load of rehab following any surgery, which will include a lot of the exercise mentioned here, And to find out more about how to progress the reps and sets, the exercises, we have it all covered in this video here, and other things to look out for when looking at modifying activities. I hope this video has been useful for you. We have covered loads of other conditions on our channel, so check it out if you are suffering from any other ailments.